Last. Oh, we're live. All right, great. Welcome everybody. Happy Friday. Nice to see. Hopefully, see some people here. It's the partnership at Drug Free New Hampshire's Friday's Facebook Lives, and today we are here to talk about Drug Take Back Day, which is happening tomorrow. My name is Julie Yerkes, and I'm the Community Engagement Lead for the partnership at Drug Free New Hampshire. And we are, our mission and vision is to have everyone in New Hampshire understand the issues impacting substance misuse and have the tools and the skills and the knowledge in order to help change those problems and issues. So thanks for being here today. We've been doing a Facebook Live each Friday here in October. October is a prevention-packed month. We started off with a bullying prevention conversation with Teen Institute. We spoke about, what was our second one, Julianne? We talked about Sober October. And then we had Brian Daniels last week for Red Ribbon Week. And today I'm really thrilled to have Greg Williams here to talk about, National Drug Take Back Day. Thanks, Greg, for being here. For those of you who
thanks for having me.
Yeah. For those of you who may be listening, please chat us in. Where you're from, where you're listening from, and any questions. We'd love to answer anything that comes up during this time that we're together. So, Greg, welcome. It's really nice to see you again. Greg and I have had the pleasure of spending the week together in a 4-day training on substance abuse prevention skills training all week together here in Concord, and now he's back up in his neighborhood in the North Country, where he is the Substance Misuse Prevention Coordinator for the North Country Regional Public Health Network. So thanks for being here.
Thank you for having me. Thanks for inviting me on. I really appreciate it. Yeah, it was great seeing you and making new connections at the training this past week, 4 days down in Concord. It's a long drive from the North Country, but well worth it, and really had a good time. And I don't know, for people that don't know, you and I did it a few years ago, and it was great to reconnect.
Yeah.
So awesome. Thanks for having me on, and it's good to be back in the North Country.
I bet. Probably a little chilly up there, but tell us a little bit, tell us about your role. What's a Substance Misuse Prevention Coordinator?
Yeah, well, first of all, I've been in the role for about 5 years. So a Substance Misuse Prevention Coordinator really has a lot of freedom to go out and impact the community. What we do is basically take initiatives like Drug Take Back Day, like Red Ribbon Week, all these different state initiatives, local initiatives, and we bring them to the people, we facilitate them, we keep them healthy, thriving, and going. Part of my job is to connect with all different sectors of the community, schools, coalitions, help coalitions thrive. So everything to impact the substance misuse problem that's going on in our region. I work for the North Country Health Consortium, which is one of the 13 public health regions, and my area is from Haverhill all the way up to Pittsburgh to the Canadian border. So it's a large area, but it's a place that I really love. I really love this community. I moved here 20 years ago, and it's really special to me, and so many great people, and I've been fortunate enough to make a lot of connections, and that helps me get the word out about things like Take Back Day, like today. So,
great.
I'm in Lancaster right now at the Lancaster Police Department at their Take Back Day. Their drop box right here, and Take Back Day is tomorrow. Yeah.
Okay, great. So tell us a little bit more about that. It's a national, effort. What is Drug Take Back Day?
Wow. It's probably, from what I can see, one of the most successful events to go on in the country. It's astounding how many pounds of potentially harmful narcotics get disposed of safely in not only our region, the state, but nationwide. So it's an initiative where no questions asked. You're allowed to come you come to the PD, and you can just properly dispose of potentially harmful narcotics. We have a lot of boxes up here in PD lobbies like this one that I'm at right now, and from 10 to 2 tomorrow, you're able to, no questions asked. If you have a harmful substance, you're able to come here, dispose of it, and they will get rid of it properly. So taking it out of the cabinets, taking the risk of potential harm away, and getting it to a place rather than flushing it down the toilet or doing harm to the environment or to obviously loved ones that might be staying with you.
Okay, great. Thank you. So no questions asked. It's there. So you're standing next to one in a lobby. Are there other ways that communities approach Drug Take Back Day?
Yeah, I'm in the lobby of the police department. A lot of them do it this way. A lot of them have, you come right to the PD. Do not be afraid if you're disposing of something. The police are here. There's no judgment. There's no asking, no questions. You come up, you drop them off, you leave. That's it. It's it's a great program. But around our area, we have a couple of unique things going on. In Littleton, they're going to be at the Walmart tomorrow. That way you can get a little bit more visibility. And I believe up in Colebrook, it'll be at the hospital, because in Colebrook, they have the drop box at the hospital at Upper Connecticut Valley Hospital in Colebrook. So what you want to do is really check with go to DEA.gov and check it out and see where they're taking place. But if you have any questions, I would recommend asking the police department. They can direct you for sure. We have it completely covered up here.
Yeah, great. I think my friend Julianne, it's her birthday today, is going to put in the link to the DEA's Drug Take Back search portal. So you can click on that link. It'll bring you to a page. You put on your zip code. You say how far you're willing to drive, 10 miles, 20 miles, and it'll give you some options of where you can go and participate in this wonderful prevention activity. So you can bring in prescription medication. And I also saw that this year you can bring in vape devices and cartridges.
Yeah, it's really important. Everything gets incinerated, so they pack it up in a big box and they get destroyed. If you have vape cartridges or vaping materials, you need to dispose of them as well. We just ask that no sharps. One of the things, they don't want sharp objects like needles, syringes, that type of thing. I would contact the local police department to find out how you can dispose of those properly. I know up in Colebrook, they do have a sharps drop box up there next to the drug prescription drop box. So, I'd like to see more of them around, but, we're getting there.
Great. Thank you. So why, you mentioned, a couple of things, right? You mentioned that by disposing of this safely, right, by bringing them in to these collection times, you're not flushing them down the toilet, because that can be harmful for the environment, right, and harmful for the water systems downstream, and keeping them out of the hands of others around the house, right? Can you speak a little bit more about how why disposing safely and kind of removing unused or expired prescriptions from the house is so important?
Yeah, so, we live up in the North Country, so there's a large hunting culture up here, and obviously there's people own guns for hunting, and I kind of relate the two together. Like, you have a gun, people are responsible, you lock them up. If you have medication, you should be locking that up as well, because they both can be harmful. They both can be useful and they both can be harmful. So when prescription drugs get in the wrong hands, like for instance, if you're raising a grandchild or something due to some circumstances, and they accidentally get into your medicine cabinet, it can be tragic. It can be very tragic. If anybody gets into your medicine cabinet, that's where tragedy can happen. And we're trying to avoid that. We're trying to get people to be more conscious of what can happen in the dangers of medication, misuse of the medication. So it's really important to safeguard these medications. And really, not only, I mean, I have pets, right? So you don't want to leave stuff around and accidentally something happen to your pet, your family, your friends, your loved ones. You know, you want to keep everybody safe. So lock up your medications like you would any other potentially harmful product.
Awesome. Thank you. And so you can, you know, how can we lock them up? I know that there are, you know, I think about when my kids were younger and, you know, those toddler, you know, like the door locks, right? The little zip tie things to make sure that the kids couldn't get in the lower cabinets. What are some strategies for locking up or, you know, keeping medication at home when it's being used, when it's, you know, still, it's not expired, you know, it's a current medication, because those other ones we probably want to be bringing tomorrow, right, to drug take back day. Expired medications, stuff that
Right.
you're no longer using, you want to get those out of the house, right? I think in New England we tend to have that like frugal, like, well, I might need it someday. You know, medication is expensive. We don't always want to get rid of things we may need someday. You should see my attic. But like, that's probably not a great thing for expired medication or stuff that we're not, you know, is no longer, you know, applicable to our current condition.
Yeah. So probably the easiest thing you could do is buy a prescription lockbox. They sell them. I believe they sell them at Home Depot. I could be wrong, but from what at Home Depot, you can go online. Everybody shops on Amazon these days. So look up prescription lockbox and you can lock it up like you would anything else. You know, I mean, I would suggest maybe put them, if you have a gun cabinet, you know, you can lock them up in there and safeguard them, you know, but definitely that's one strategy, you know, but the most important thing is that you're conscious that these don't get in the wrong hands, that the medication should not be shared. You should not share your medication with other people and prescribe for them. And if you're a young adult, you should not be taking any medication that's not prescribed to you. That's very, very important to understand. It can lead to immediate tragedy. It can lead to a lifelong problem, you know, and that's obviously what we're trying to avoid.
Okay. Great. Thank you. Yeah. And, you know, I know just even keeping it up in a way, right, especially for pets and young children, you know, that maybe it's something that you're using every day. Locking it up sounds really hard. A minimal strategy would be out of, you know, high, you know, out of sight, out of reach from others. Right. So, but ultimately, you know, keeping it kind of in a locked container is a great idea, and disposing of anything that, you're not currently using. I'm working tomorrow from 10 to 2, for example. You know, I can't make it tomorrow. I'm just hearing about this today, or maybe someone's going to watch this tomorrow morning or tomorrow night or Sunday and go, oh gosh, I missed this day. What do we do then? What if we miss tomorrow?
Great question. Great question. You can go on a website at da.gov. I'm not sure if you're probably going to put it on the screen pretty soon, but it's
Juliana, share that one. Yep. The year round. Okay.
Right. The year round police, the PDs, a lot of them have drop boxes. And if you find the drop box, you can go there. I encourage you to call your PD and ask them. They all know where they are.
Yep.
For example, in the North Country, we have about 10 or 11 drop boxes. So we only have maybe 15 PDs, and the majority of them have a drop box in their lobby. So it's really accessible and it's really encouraged. So even though tomorrow is a 10 to 2 program, you know, it brings awareness. It brings awareness to the situation. It also gives you easy access. Some departments are out in their parking lot and set up tents and have some activities all around the state. They have them they have them drive through, some of them where you can drive through, drop off. You don't even have to get out of your car.
Yeah.
But throughout the year, these drop boxes are always accessible. So it's always encouraged. And what we do is we take the material that's gathered throughout the year and we add that to the stuff on Take Back Day. And we bring them down to an incinerator and dispose of them all properly on the next week.
Great. All right. Good to know. And Julianne did just put the chat in, and I know in my region, most of the, the ones listed are actually at pharmacies. So a place where you're going pretty regularly, there's a way to dispose of your, expired and unused medication as well. So there are 2 different links in there. One is for finding your Take Back Day location tomorrow. Like Greg said, some of them are big events with a lot going on. Others are, just but your local friendly police department with their Dropbox, and then their year-round location as well. We have a lot of different resources on the Partnership at Drug Free New Hampshire's website around safe use, safe storage, and safe disposal of opioids and other prescription medication. So we encourage you to, check out those resources to learn a little bit more. And we also have, in case you want to share this information with any of your loved ones, anyone we have a wonderful, another substance misuse prevention coordinator, Annika Stanley Smith, did a little walkthrough of the life cycle of a prescription drug for us last Take Back Day. And we're going to share that again here today because it's a great thing to be able to send and share with your loved ones, just a short, sweet, really clear, because it's pictures and talking about why it's important to use it safely, store it safely, and dispose of it safely. So I really appreciate anything else you want to share with us today.
No, I just want to say, I think you had a good point. I mean, you can go to your PD, you can go to your pharmacy and ask, and you can go to your local hospitals when you're there. So I would, if you have prescription drugs that are potentially harmful and, they're expired and can be harmful, ask. The PDs will be happy to help you. I'm sure the pharmacies will be happy to help you, and local hospitals will direct you as well, because these drop boxes, like you said, around the state are in all different areas. So I encourage everybody to come out tomorrow. And, in the North Country, we probably average an astounding 1,500 pounds per year. Two events, it usually adds up to about 1,500 pounds a year in these. Yeah. So we're getting these potentially harmful things off the street and disposed of properly. So it's a great program, and I really encourage everybody to come out.
Great. Thank you so much, Greg. I really appreciate you being here. It's a timely conversation, and I hope you see a lot of people out tomorrow.
Great. Thanks a lot, Julie. Great seeing you as well.
Thank you. Thanks, everyone. Have a great rest of your Friday. Enjoy I think the sun's out today in most places. Enjoy it. It's going to be a nice weekend, maybe chilly, but nice. And everyone have a safe Halloween as well. And now go look for those little bottles that you need to collect and bring to your local Drug Take Back Day. All right. I think Julianne put everything up in the chat, so I appreciate that. And wish her a happy birthday. Happy birthday, Julianne. Have a great weekend.
Happy birthday.
All right. Thanks, y'all. See you next time.
Thank you.